Thousands of years ago, humans drilled holes into each other's skulls, not as punishment, not as violence, but as a treatment. And here's the part that surprises people most about this. Many of those patients survived. Today, on Field Notes from the Dead, we're talking about trepanation, the oldest known surgical procedure in human history. What it looked like, why people did it, and what the bones tell us about healing, care, and survival during this. Get ready, here we go. What is trepanation? Trepanation is the deliberate removal of a portion of the skull, and that's without cutting into the brain. It appears as early as the Neolithic period and continues across cultures for thousands of years. Trepanation is not a lobotomy, it is not random head trauma or even evidence of madness within a culture. Trepanation is controlled, it's intentional, and often remarkably precise. This means that ancient peoples understood that the skull protected something vital, and that opening it carried really big risks. How do we know that the people survived trepanation? This is where the bones speak really clearly. When someone survives trepanation, the skull shows rounded smooth edges, new bone growth, remodeling around the open, and some individuals lived months. And we have evidence that they lived years. Some had multiple trepanations performed during their lifetime. That tells us something critical. This wasn't a one-time experiment. It was a practice that worked often enough to be repeated. So, was trepanation surgery or a ritual? It's one of the biggest debates in archaeology. Was it medical? Was trepanation a ritual? Here's what the medical explanations would include. It would relieve pressure from head traumas. It may have treated headaches or seizures, evidence of infections or neurological symptoms. We don't really know. Here are some of the ritual explanations that could include. It'd be releasing spirits, cosmological beliefs, altered states of consciousness, possibly spiritual healing. But here's the important part. These explanations don't cancel each other out. A practice can be both medical and ritual. Healing has never been purely physical anyway. One of the most powerful things about the trepanation is it wasn't rare and it wasn't isolated. We find evidence of skull surgery all over the world, across thousands of years in cultures that had no contact with one another. That tells us something super important. This wasn't an accident of history. It was a human response to pain, injury, and illness, and possible spirituality. Let's go into some parts of the world that had trepanation and really deep dive what the difference and what the similarities are. In the Andean region of South America, trepanation is especially well documented. Here, archaeologists have found hundreds of skulls with trepanation openings, many showing very clear signs of healing. Some individuals survived months or years after surgery. Some had multiple trepanations over their lifetimes, and in certain Andean populations, the estimated survival rates went from 60 to over 80%. That level of success tells us this was a practical skill, not a desperate gamble trying to get there. These communities understood how to remove bone without piercing the brain, how to manage infection, and how to care for patients afterward. This wasn't just a surgery, it was long-term medical care. Let's visit Neolithic Europe. Think France, Germany, Eastern. In Neolithic Europe, trepanation appears in the farming communities thousands of years ago. Skulls from areas that are now France and parts of Eastern Europe show carefully scraped or drilled openings, often small, controlled, and placed away from critical sites on the skull. Many show partial or complete healing from this. This suggests trepanation may have been used to treat head injuries, chronic pain, and neurological symptoms, but it also appears in ritual context as well. Sometimes they were associated with burial practices or symbolic meaning. Again, the same pattern appears. Medical knowledge and belief intertwine. Let's visit Africa, specifically North and Sub-Saharan regions. Evidence of trepanation has also been found across Africa, both in ancient remains and in historically documented traditional medical practices. In some cases, trepanation continued into the recent past, performed by specialists within the community. What's striking is the consistency, deliberate technique, avoidance of the brain, and post-operative survival. These were not acts of violence, they were acts of treatment, carried out by people trusted with life and death responsibility. Let's jump to Asia. We're going to go towards Central Asia and Siberia. In parts of Central Asia and Siberia, trepanation appears in the archaeological context tied to both trauma treatment and to ritual practice. Some skulls show openings near healed head injuries, suggesting intervention after violence or even accidents. Others appear in ceremonial contexts, reinforcing the idea that trepanation could serve both physical and spiritual meanings. Once again, different cultures, same solution. What does the global pattern tell us? When you step back and look at the global distribution, the message is clear. Humans everywhere recognized that the head was critical, understood that pressure, injury, or illness could be deadly, and were willing to take enormous risks to help one another. This wasn't recklessness in the humanity, it was problem solving. This was across continents and millennia. Humans looked at suffering and said, we have to try something. None of this could happen in isolation. Trepanation only works when people stay and they help and they care for one another and they care for one another afterwards, which means every healed skull is evidence of community. Care, community, and recovery in this. Trepanation required care. Someone had to restrain the patient, prepare the tools, avoid penetrating the brain, clean the wound, care for the person afterward. You don't survive skull surgery alone, which means trepanation is evidence not just of medical knowledge, but of community investment. You don't perform surgery on someone you expect to lose. You perform it on someone you want to keep. Trepanation challenges the way we think about the past. It wasn't reckless. It wasn't barbaric. It was a careful, repeated, and often very successful procedure. The bones don't show us madness. They show us effort. They show us hope. They show us community. And they remind us that humans have always tried to heal each other, even when the risks were enormous, even when they didn't fully know. The oldest brain surgery isn't a story of cruelty. It's a story of care. If you like anthropology, human weirdness, cultural weird deep dives, bones, and all things kind of mysterious, follow, share, listen, and comment. I'm always open to hear from you.